seconds. Marcela is a data quality immunization specialist in Comprehensive Immunization Special Program of the Pan American Health Organization, where she has worked for the last 8 years. In her current role, Ms. Contreras provides technical and strategic support to improve immunization data quality and information systems of the countries and territories of Latin America and the Caribbean. Ms. Contreras is from Chile, and prior to her work in PAHO, she was a research assistant at the School of Economics and Business at the University of Chile, and the former manager of the Chilean Expanded Program on Immunization in the Ministry of Health. So I will hand it over to you, Marcela. Thank you for joining us.
Thank you. Muchas gracias. Buenas tardes. Good afternoon. I'm going to present on behalf of all the countries of the region of the Americas. So thank you very much for the countries that are here. Regarding the experience and best practices of implementation of electronic immunization registries in Latin America and the Caribbean. So for that, I'm going to give you a small context at global and regional context. So we need more information for program management. We also are transitioning from vaccination in the childhood to the life course perspective, increased focus on oversight and accountability of the immunization agenda, our regional immunization action plan. Also, the new technologies are introducing in the different EPI programs, integration of the health information system with digital health, e-health policies. In the region, we have this document that is guiding principles of digital health for the region of the Americas, and also COVID accelerate the introduction, the implementation of digital health in the EPI programs. But also in the region, we have our context that is more urbanization, a lot of natural disasters, political context, and also equity issues. The region is one of the most inequity regions in the world, and also a lot of displacement. We also have our strategic guidelines as the resolution of digital health from WHO, and also our immunization agenda 2030. And as a PAHO, we also have our roadmap of digital transformation, also a policy regarding application of data science, and our regional reinvigorating immunization program immunization as a public good for universal health, and our technical advisory group recommendations that are also providing recommendations regarding digital health in the EPI programs. So with all of that, one of the tools that the EPI programs in the region have been implementing is the Electronic Immunization Registry as a digital tool for immunization. So, but what is an electronic immunization registry? The EIR are those that provide the vaccination history. They are computerized nominal records and are part of the immunization information system that can be integrated or interoperating with other information systems for immunization, such as surveillance systems, stock management system, among others. Sorry. Just to mention that the system, this electronic immunization system, the value of that is that helps the healthcare worker, or should help the healthcare worker to follow up the population, also provide and support to facilitate the coverage monitoring. But the most important part is that you as an individual has your own vaccination history available. So in the region, we have been learning together with the country. So this is the ideal characteristic of an EIR defined by the countries of the region. So the system should have demographic records. So through inclusion of all persons who are EPI target, the vaccinated, but also the unvaccinated. And now this is very important with the zero dose children, for example. Another important characteristic and countries of the region are advancing on that is the unique identifier for follow up each individual. Then regarding vaccination event record, it's important to have the information of the vaccine administered, including all vaccination acts. Also help the traceability of vaccine products and can help also the follow-up with the SAVI IF. Regarding reports and individual follow-up is important because support the coverage data and other program indicators, consolidation of data at different administrative level, and also the geographical disaggregation, that is very important. Data and information on people who is spending on for vaccinations. E-data should fit into data visualization. And regarding the system, it is important to have data entry closer to the act of vaccination. It should be ideal. This is the ideal that the electronic immunization registry is in the same vaccination room. User-friendly, of course. Flexibility in case with all the changes in the schedule, new vaccines. So it is important to have a flexible system. And the data safety and privacy of the data. Now we are working with individualized data, so it's very important. So this is the current status of the region. This is a map that we want to be all in green, and we have been progressing, advancing a lot. We have some countries in blue that are in progress, and the Caribbean, we cannot see here all the Caribbean countries, but they are progressing very well too. So I want to present some country experience using this electronic immunization system. So we have the first case of Bogota, Colombia, where they are using the EIR data integrated with a geographical information system. So it serves to define, to plan different strategies to go to places that probably is hard to reach, so they can define some strategies. Brazil has in the system a list of unvaccinated children for healthcare workers to follow up and define strategies to reach them. Bolivia and Chile are using the system for different analyses beyond coverage. For example, the timeliness of the vaccination, the use of the system, the date where the data is entered in the system. So we are exploring new ways to analyze the immunization data. Here we have other examples regarding dashboard. So we have the example of Chile using the EIR system for influenza vaccine monitoring. With COVID, we saw a lot of dashboard for COVID. So we have here two examples, Uruguay and also our friends from Panama. Guatemala, who is using the system in a dashboard for routine immunization. We are also working with countries in integrate the electronic immunization registry with digital certificates. We saw that with COVID, but now we are trying to go beyond COVID and try to introduce this with other vaccines of the immunization program. So, sorry, we had the example of Argentina, Honduras, and I don't remember the other country, sorry. So for that, PAHO has been working with countries, learning from the whole experience. We are learning together, and we support in all the stages, since the planning, design, implementation, the analysis of data. Countries are doing big efforts to implement this system, but they are not using the data. So we are now trying to promote more the use of the data of these systems. And of course, monitoring and evaluation. Now we are currently doing a EIR diagnostic, how the countries are doing, what are the main characteristics of their systems. So we hope to have results soon. As I was mentioning, we are working also with the digital certificates and linked this with the electronic immunization registry. So next month we have a connectathon to test this with other vaccines beyond COVID. We also developed a document, a guideline for countries to implement electronic immunization registries, for EPI managers to know. Sometimes this language between the informatics and the technical program, the API program, is not always well coordinated. So we provide here some guidelines for them to have as a tool for communicate with them. We did a training course with the Geneva Learning Foundation, and now we are developing this course in the PAHO virtual campus. Here we have some nice picture of the different instances that we have with the countries. So we have here some case studies from countries and how they have been developing this system, that I think that is very important for other countries and even countries from other regions to know what happened. We also have technical documents, exchange of experience, even among people from the region, but also we have been inviting people from other regions to come to the region and learn from there. So here we have very good pictures of those nice experiences. Here there are some important factors that countries think about this. So countries from the region and even from other regions maybe have the same challenges, they have the same issues. So it's good to have this community to learn from others and build together. It's important the governance difference and synergies between the electronic immunization registry and electronic medical records, how they can be integrated. Need for a regulatory framework, e-health policy or digital health in countries, this view of life cycle stages, guarantee the maintenance and sustainability. Sometimes they just think in the software or the investment of that moment, but you need to think in the sustainability of the system. This is very important, respond to the local level. This is sometimes we as a EPI manager at the national level want a system, but the system should be helpful for the healthcare worker. Promote the information from the EIR, the use of the information, data quality. Now it's different, it's not just a paper-based system, so we need to think, go beyond the paper. Transition period and change management when you are implementing the system. This is a question that we receive from different countries. Delete the paper. So we don't have the answer, but it's an important issue that countries have been talking about. Promote the use of mobile technologies integrated and feasibility of the EIR implementation in all countries. We are not saying that all countries should have an EIR. They should know their context, so it's important to measure this feasibility. So just finalizing my presentation to mention that we, as with the countries, define some strengths of having a good implementation of these systems. So if the system is well implemented, it could help to better and more homogeneous coverage, reduce inequities, improve program management, better data quality if it's good implemented, better data access to data, better vaccine inventory management if it's connected, integrated to this module, and get information for confidence in vaccination. Some challenges: infrastructure limitation, internet, electricity, governance and regulations are not in place, digital literacy. Sometimes we want to implement digital tools, but maybe the healthcare worker is not prepared for that. Deployments without in-depth review or pilots, evaluations, integration training, implementation of interventions without considering end users, and we try to avoid inequalities. We don't want to increase the inequality for using an EIR system. So thank you very much.
Thank you, Marcela. That's great to see the progress that's being made with this really important tool. I also just want to thank Marcela for presenting in English for this group and highlight that there are Spanish language presentations being provided by our host PAHO region participants. So the next one, the last chance is tomorrow at 10 o'clock in this room. The breakout will be Spanish. So please consider coming and grabbing a headphone on your way in so that you can hear some more news from the PAHO region. We're going to take a couple questions and from Marcela's presentation before we move on to the next. So anyone have any questions? Yes, Nga. And there's a microphone coming for you.
Hello. Thank you, Marcela, for your presentation. I don't know whether you remember, we have discussed some years ago in the beginning of our IDEO Vietnam project about EIR in Vietnam also. We exchanged a lot of experience. So you talking about, and we're very impressed, always impressed with the situation of EIR implementation in PAHO region. I don't think any other region have impressive result like that for EIR, to be honest. And many countries in PAHO region already implemented EIR for a long time. So when we're talking about the last mile for EIR implementation is a completely transition to paperless system. So I have a question that could you please tell us that at this moment, how many countries in the PAHO region already completely transition our paper-based system? Because it's not easy answer even in Vietnam. We have been implementing EIR as a national scale since 2017. But until now, it's still a lot of challenge issue, and due to many different reasons, that we still cannot completely phasing out paper-based system for the whole country. Just some selected province that part could help, but other province without support from us is very challenging. So I want to learn from you. Thank you.
Thank you, Marcela. I told you I'd give you a question. I'm Rebecca, and I work with the American Immunization Registry Association. So all the U.S., we've had the pleasure of working with Marcela as well. I'm curious if you can say the impact of COVID on the electronic immunization registries across the region that you cover. Was it positive? Did you see a lot of promise, or was there a step back during that time?
So then Anne, and then there was one more question over here, and then we'll stop and have the answers.
Sorry. So Ann Lindstrand, Unit Head EPI in WHO. Before my WHO life, I was EPI manager in Sweden. And I painfully was seeing the evolution of introducing an electronic immunization registry in a high-income country. All the issues you talk about, the legal issues, data access, change management, all of it. We decreased our coverage in Sweden substantially the first, at least 5 years, and was actually having to do a parallel system at the same time. Admin data using, and then also the electronic. I wanted to know, on a whole in PAHO, so many countries have introduced. Have they all decreased in their coverage while the introduction? And what are the measures kind of that you were working on and talking and advising countries to take forward? Thank you.
Thanks, Anne. Then one more.
Thanks for the presentation. I guess one of my questions, Marcela, is if you can comment on the cost of the EIR, I think often when we're trying to implement it in a lot of the countries that we work in, cost becomes a big factor in terms of implementation, deployment, development. And then this question of like, is that cost actually enabling us to reach more kids? And do we have evidence that it's helping us reach more kids? So I'd love to hear your perspective.
Thank you. Back to Marcela. Oh, it's a, yeah, thank you.
Thank you. Thank you very much for your questions. Regarding the place, and of course, I remember that exchange of experience with Vietnam. The truth is that some countries have tried to delete the paper. However, the nurses always want to have their backup. So at the end, some of the countries have decided not to delete the paper, but reduce all the papers that they have in the health facility. That is a lot. And try also to interoperate with other systems to reduce not just immunization system, but also other health programs. But we have just one country, I think, and I'm not sure if Chile also delete the paper, but they are very mature systems. And so I think there is not an answer, but we also give some recommendations. And even for data quality, we need to compare with something. So yeah, we are in that process. So I'm happy to learn from you too. Regarding the impact of COVID, Rebecca, yes, it was positive in the way that there were a lot of investment, a lot of countries that maybe before took a lot of time to plan and to do all the process. Now it was like, okay, implement this system for COVID, and now some of them are trying to go with the same system for the routine immunizations, but also countries that they have an EIR system for routine, they scale up this for COVID-19. So in some way, we are taking those learnings and implementation and investment that we had during the COVID for the routine immunization program now. So I'm saying that it was positive, of course, just in that specific topic. Regarding the decrease in coverage is true, and some of the countries are doing the same, like using parallel system to compare the electronic immunization registry data versus the administrative or paper-based aggregate system. And some of them are taking the decision of having the official system once the both data are similar. So yeah, but some of them they decrease, but they have the information there. They have the individualized data. So now it's not a number, it's a person. So in some way that I think add value to the country, but I understand what you are saying. And our recommendation in that case is wait until your system is mature to take the decision of going just with the EIR system. But for COVID, some countries, they just went with the EIR system. So let's see. And regarding the costing, the truth is in the region we haven't done a lot of studies. I know Honduras did one recently. But I think the contexts are also different because before we didn't have a lot of public goods, information system as a public good. So they developed the system from scratch. And now we have more tools that countries can use, and I think that can reduce the cost, but we haven't done, and maybe that is something that we need to work more. Thank you.
Thank you so much. I think we have time for one more question. It has to be a short one. If there's anyone else who wants to ask one final question. Okay.
I'm asking two questions to everybody.
One question.
Yes. but for everybody. WHO Europe region is have a collaboration with PAHO at the moment. I'm not sure, but maybe a good idea.
No, well, we have tried to have more collaborations, but super happy to work together. Yeah.
Our country may collaborate and share experience with you, PAHO region, Turkey.
Thank you, Marcela.